So when we're looking at management of Alzheimer's disease, there are things that we want to think about. When we go back and look at our mnemonic of dementia, right, there are some modifiable risk factors there. So that can include minimizing those drugs that are associated with cognitive impairment, but also a lot of lifestyle stuff here, right? So maintaining a healthy weight, obesity in older adults does increase risk. Managing hypertension, and that can affect things like vascular dementia, right? Because of things like hemorrhagic stroke, for example. Managing diabetes, managing lipids, treating mental illness, all of these things, when managed well, will overall reduce someone's risk of developing cognitive impairment and can potentially slow progression. So we use medications, so pharmacological medications, to slow impairment. Okay, the anti-amyloid antibodies are considered disease-modifying treatments in a lot of spaces. We don't know for sure. It's certainly reducing biomarkers, but we don't know the long-term benefits just yet of those anti-amyloid antibodies. So in general, we are preventing further decline or slowing decline. We want to avoid those medications that are cognitive function promoters. We want to manage blood pressure, lipids, glucose, etc. And a lot of important things include the social support aspect. So talking with family, offering them support, illness education, but also things like legal planning, financial planning, because individuals, as their illness progresses, will lose some of their decision-making capacity, and understanding your loved one's wishes is really important. So when we're looking at our non-pharmacological interventions, it should be patient-centered, okay? We want to try to avoid stress and frustration, because that oftentimes will lead to behavioral challenges. Having simple activities that individuals enjoy. There's this TikTok guy that I watch sometimes. Yeah, I watch TikTok. It's okay. But there's this TikTok guy that I watch who's a caregiver for his grandmother. And his grandmother folds napkins every morning, right? And part of the benefit of that is it gives them a task. It gives them something to do, but it's fairly simple, so it's not going to cause frustration. Therapy animals can be beneficial, so having a cat to pet or a dog to pet. And then avoiding being confrontational or challenging. So if someone forgets that their significant other is deceased, reminding them doesn't help, right? Arguing with them about who's doing what or where or how old someone is or if someone's alive only causes distress to the individual. So imagine not knowing that the love of your life is dead and being told every day, and coming to that realization every day. It can cause a lot of frustration and a lot of distress. So learning how to communicate with more of like a yes and aspect, more improv, right, than arguing with the individual. We also can do things like cognitive training. There's some mixed data regarding the benefit of doing cognitive training in individuals, but they can improve things like global cognition, fluency, but most outcomes, the data is kind of but essentially it's a guided practice of very specific tasks that they'll repeat to help improve or help maintain attention, problem-solving abilities, memory, etc. So this goes back to neuroplasticity, right? So the brain being encouraged to form appropriate connections, more efficient connections over time. So some other supportive therapy when we're thinking about some of the non-cognitive symptoms like psychosis, behavioral disturbances, depression. We'll spend a little bit more time about behavioral disturbances a little bit later, but the non-cognitive symptoms, we want to think about environmental interventions if possible. So really redirecting, making sure that they can hear, making sure that they can see, keeping a day-night cycle, and addressing any potential medical, environmental, other type of precipitating causes that we can reverse. And of course, unfortunately, there's also, I know it's hard to see the word, there's also things like elder abuse, right? Or an individual that has unmet needs that they are having trouble asking for.